Hello everyone, I am Dr. Meenal Mohit, Consultant and Head, Department of Endocrinology, Manipal Hospital, Jaipur. On the occasion of World Obesity Day, I take the privilege of talking to you about what is obesity. We define obesity as the accumulation of excess adipose tissue in our body. How do we measure obesity? We have various parameters, and the most commonly used is BMI, that is body mass index. Body mass index measures your weight in kilogram in respect to your height, that is kilograms per meter square. If you are more than 23 kg per meter square, you are considered overweight. If you happen to be more than 25 kg per meter square, you are considered obese. Now, as per the latest definition, if you are obese with any of the complications or comorbidities limiting your physical activity, then you have stage 2 obesity. But if you are only obese but no other comorbidity and no limiting physical activity, then you have stage 1 obesity. Is BMI the right parameter? No, definitely not. Because a man can be muscular, but that is not a disease. So, we use other parameters like your waist hip ratio, where your waist should be less than 90 centimeters if you are a man, and it should be less than 80 centimeters if you are a woman. Other parameters measure your waist in respect to your height. So your waist height ratio should be less than 0.5. So these are the various parameters. Besides that, you can also measure your visceral adiposity. If you have more than 25% of the visceral adipose tissue, then you are overweight. If you have more than 38% of the visceral obesity as a woman, then you are considered overweight or obese. Is there a rising trend of obesity in the recent era? Definitely yes. So, what are the factors contributing to the rising pattern of obesity? First of all, it is our changing lifestyle, our changing eating patterns, our decreasing physical activity, increasing sedentary life, increasing screen time, our devices, our gadgets, then the society and the environment, which is making it less safe for us to go out and exercise or play around, which is limiting the outdoor physical activity or the outdoor sports of our children also. Then, of course, the ethnicity. We Asians have the tendency to be thin, fat Indians. We have higher percentage of visceral fat and visceral adiposity. Then, the fetal life, the embryonic life, that itself starts the adiposity in us, either by undernutrition or by overnutrition. Both contributes to the obesity in the adulthood, and that plays a very important role. So placenta, the ephemeral organ, becomes one of the most important organ contributing to adiposity in adulthood. Now, why are we concerned about obesity? Obesity in itself may not be so far considered a disease and may be taken as a cosmetic problem, but in actuality, it contributes to the increasing incidence and prevalence of type 2 diabetes, prediabetes, increasing incidence of cardiac events, cerebrovascular events, increasing incidence and prevalence of osteoarthritis, depression, psychosomatic behavior disorders. So, obesity contributes to significant morbidity. So, can we do something to prevent it? Prevention begins right from the primordial prevention, where we take care not to allow obesity to set in at all. Then we come to primary prevention, secondary prevention, and tertiary prevention. So, the behavioral change has to begin right from the childhood, or rather, right from the fetal stage. Behavioral pattern has to change for the entire family, because family eats together, sits together, lives together, and the lifestyle also they share in common. Then genetics plays an important role, of course. So families are commonly we see the clustering of obesity or adiposity in the families. So, besides the lifestyle changes, we now have some molecules also in pipeline which have been approved by FDA for the treatment of obesity. Most commonly used at present is GLP-1 RA. We have injectable GLP-1 RAs as well as oral GLP-1 RAs. They have been approved for the management of obesity. Newer molecules like GIP, amylin, glucagon, and many more. They are all in pipeline to manage obesity as well as diabetes. So, moving beyond molecules, we have seen significant good results with bariatric surgery also. So, that is employed only in cases of morbid obesity, but definitely, yes, it plays a big role in preventing morbid complications. Why do we observe World Obesity Day? So 4th of March every year is observed as World Obesity Day, and it is significantly important and required to bring about awareness in the masses. Education is important. At least one day we should draw our attention as a whole, as a combined effort, we should upfront that yes, obesity is a disease or at least the root cause of major metabolic diseases, and it is high time that we all unite together to prevent obesity, to prevent metabolic complications arising out of obesity. Thank you.